Good morning. My name is Chelsea Bowett. I'm an internal medicine and pediatrics physician, and at 34 years old, I was diagnosed with stage 4 colorectal cancer. I have a strong family history of colorectal cancer. My maternal aunt was diagnosed at 50. Her cousin was diagnosed at 40 and died within the year. It turns out both my grandmother and my maternal great aunt have had advanced adenomatous polyps since they were in their 40s, and at no point in getting colonoscopies every 3 years for over 40 years now, and at no point did anyone think to tell my grandmother or my great aunt that these could increase the risks for their children. So both my aunt, my second cousin, and myself all could have been diagnosed at an earlier stage had our screening recommendations been handled appropriately.
Good morning. My name is Danelle Saransky. I'm a stage 2 rectal cancer survivor. I was diagnosed at the age 19 and soon discovered I had Lynch syndrome. Cancer has altered the course of my life dramatically. Though I'm a 15-year survivor, cancer has robbed me of many things, and the worst being my fertility. Infertility has been one of the most painful parts of this journey. I feel a void in my life every single day. I feel an emptiness in my heart that will never be filled because I am barren. I feel like I'm not enough as a woman. I feel broken. I've never allowed myself to grieve the loss of a child I never had. Why didn't anyone ask me what I wanted? Why didn't I get any options? I know I was young, but this was my future. I am thankful I've been gifted with my life, but I will never be able to create it.
Good morning. My name is Susan Fowl. I'm a mom, I'm a sister, and I'm a grandmother also. But I also, one of my biggest roles I've had was the caregiver of my son, Chase Johnson. Age 24, he was diagnosed with stage 4 colon cancer. And there was no factors of health or family history. And it was not on the radar of our family. During that journey, one of the biggest misses that we had was in the palliative care area and also in all the doctors, no mental health support. Our family system was a mess, and we could not find the mental health services that we would need during that time period. So I really want to pass that on, that's so important. Individual therapy, family therapy. And the other thing is that Chase passed away in January of 2015, and the same thing with the mental health services. Now I'm a mom. I have a hole in my heart. I will never get rid of that hole. I carry that pain every day now that he's gone. I'll never be able to hug him again and ever have a conversation with him again. And that's my story.
I'm Kevin. I am a stage 4 colorectal cancer patient in my 5th year of treatment. And what I know now as a patient would have helped me so much early on. I have always had great care. What I didn't have was a better understanding of what to expect. They told me about chemo, about the drugs I was taking, and about the side effects I could expect. But there were other things they didn't tell me that would have improved my experience, like incorporating palliative care into my treatment plan. No one told me what palliative care was, or that there was a palliative care clinic and program at my comprehensive cancer center. No one told me cancer and chemo would take a significant toll on my mental health. No one told me there was an adolescent and young adult support program at the hospital. No one recommended I speak to someone who has been through it and would truly understand. No one recommended cannabis as a way for me to combat nausea. Even when these resources are available, patients aren't always connected to them. Patients, especially young patients, haven't prepared for this and often don't know what they don't know. Providers shouldn't assume a patient will figure this out on their own, especially when support systems fall under a word most patients have never even heard of, a word that is intended to greatly improve the quality of life for all patients and their families.
My name is Sarah DeBoard, and when I was 24, I went to my gastroenterologist with blood in my stool. He did what he was supposed to do, and he performed a flex sigmoidoscopy on me, but he couldn't find the source. So he said to me, "It's probably just hemorrhoids. I don't see any, but that's probably what it is." I didn't know at that moment that he sealed my fate, because I would say that to myself every time I went to the bathroom for the next 10 years. It's probably just those hemorrhoids I don't have. When I was 29, my maternal aunt was diagnosed with metastatic colon cancer at age 51. What I didn't know at the time was my own mother had had adenomas removed starting at age 40. Her gastro knew that. He knew about my aunt, and he never told my mother our family was at risk and we should be screened. When I was 33 years old, I was waiting to be discharged after having my second baby, and the obstetrician on rotation came into my room, and he kind of hummed and he howed, and I really want to let you go, but your labs, they're just not quite right. Your hemoglobin's really low. And the more he sat there, he said, actually, I think they mixed your lab work up with the girl next door. I'm going to let you go home. And he discharged me with no follow-up. 11 months later, I walked into urgent care so weak, so underweight, and so sick, I didn't even have the energy to hold my baby while he crawled around on the dirty floor. A few weeks later, I would get the colonoscopy I needed, and I would find out the source of that blood. And I would find out I had metastatic colon cancer at 34.
My name is Allison Rosen. I was diagnosed with colorectal cancer at the age of 32. I live with an ileostomy, appropriately named Phil, every day. I originally had a J pouch, and it was accidentally punctured, which resulted in a permanent ileostomy. So I have that now for the rest of my life. Things that happened to me while I was going through 3 different ileostomies were an allergic reaction to the adhesive. I had to go to the local ostomy clinic every day for a month until I figured out the appliance that would work which I could live with, that wouldn't cause a leak. I really think that the ostomy improved my quality of life, but at the beginning when I talked to my doctor, I didn't know. I had no idea. I was young and I was dating, and I didn't want something external. If I had known that, I would have had colostomy surgery the first time, not had 3 open surgeries. I had my bag explode on me while I was sleeping multiple times. I spent many, many nights as a young adult patient dealing with body image issues. I was initially embarrassed about dating, and now I write articles about it because I'm not ashamed about my body anymore. But I didn't know there was support. I didn't know anyone else that had an ostomy on my age, or anybody that had an ostomy. No one told me about the United Ostomy Association or support groups that were available to me. I serve on an ostomy support team at MD Anderson now, and I go and talk to patients when they get an ostomy. And if I had had that, it would have changed my whole life 6 years ago. I go surfing, I go hiking, I am in a body image fashion show on a regular basis. And this support is so desperately needed, not only for young adults, but for everybody. So I do what I do so that other people can get the help they need and find their voice just like I did.
Good morning. My name is Eric Reddy, and I'm from Boston, Massachusetts, and I feel my colorectal story is best told through numbers. So 35 is the age that I was diagnosed with stage 4 metastatic colon cancer. 5 is the number of trips that I made to my PCP, my PA, and the surgical consults I had before I was properly diagnosed. 3 is the number of emergency room visits I had before I was properly diagnosed as well. 3 is also the number of surgeries that I've been able to have since my diagnosis, and 12 is the number of rounds of chemo that I was able to get through. 1 is a really important number to me. It's been 1 year since I had no evidence of disease. And 11 is really the number I'm most important of, because that's the number of people who are close to me who actually took it upon themselves because of my diagnosis to get checked out, see their physician, and actually ask those questions that I never knew about before.
Good morning. I'm Valerie, and I was diagnosed at the age of 49 only because of not knowing my family history, I feel. I had lost a brother in 2010. He was 67. He didn't share his diagnosis with the family. He was a Vietnam vet, one of those strong human beings, but he didn't share it with the family. And at the time, in 2010, I still thought colorectal cancer was an old man's disease. I had no idea that I was high risk. I had no idea all the symptoms that I had were pertaining to colorectal cancer because simply the accessibility of knowing what happens was not there. And that's just 5 years after my brother passed. And so I say to this is that doctors need to be able to clarify that there's something more that's wrong with you other than just that you're anemic or that you're having stomach problems, and get to the bottom of this, because too many of us are being diagnosed at young ages and not knowing your family history, as many people have said in here. Doctors ask for it all the time, but I don't think they're using it properly. And our families are not sharing the information properly. And I think it's so important that we get this out to young adults, because, again, I was 1 away from 50 and 6 away from the time that I should have had a colonoscopy. But I was diagnosed in the ER 5 years later after my brother passed, all because I was not educated and I didn't know what it meant to be diagnosed as stage 4 colorectal cancer.
Hi, my name is Tabitha Kavanaugh, and 2 weeks before I was diagnosed with stage 3 colon cancer at age 31, I also found out I was positive for the BRCA1 gene. For years, my doctors collected information about my family history just to do absolutely nothing with it. My grandfather, also BRCA1, my mom, also BRCA1, my aunt, also BRCA1. My grandfather battled 5 different kinds of cancer, including colon cancer, and has beat them all. My thought that colon cancer wasn't for me because I was a healthy young adult. Every time I saw my doctor, they told me I looked great, I was young, I couldn't have colon cancer. I spent a year searching for answers to my symptoms, and like Sarah and like so many others, I got, it's probably hemorrhoids. A complete assumption with no follow-up and no suggestion to see a specialist. So severe bleeding 1 week before my wedding sent me to the ER, and that was the last straw. I got a colonoscopy a few days later, and 4 months later, after an emergency colon resection and 6 months of chemo, here I am, I'm still standing. But because of my BRCA gene, I've also had to make some tough choices. I've had a full hysterectomy, and I'm actually still recovering right now from a double mastectomy. So knowing your family history and getting tested for genetic mutations and advocating for yourself is essential, no matter your age. If I would have waited until I was 50 to get screened, I wouldn't be here right now.
Hi, I'm Kim Newcomer. I'm a stage 4 rectal cancer survivor diagnosed at 35. I do have family history of cancer, of colorectal cancer, and I knew what to expect from all of my treatments. But what I didn't expect was infertility and the sexual aftermath of experiences that came with rectal cancer treatments. I'm now 10.5 years out from diagnosis and 5.5 years dead, but treatments have left me mutilated and I've lost all sexual function. Even though I've survived rectal cancer, an important part of my life has been taken from me. No doctor recommended dilators, or gave me information on what to expect during treatment. Reconstruction left my body mutilated. I feel like I'm not a whole person, and I will never be enough for my husband. Fertility was never brought up. I will never be able to have children. I've not been able to have sex since 2009, and I will never be able to have sex again. Sorry. We all know that sexual function is an important component of life. I've lost all fertility because my oncologist and my radiologist never brought up the subject, never gave me resources, and it was never talked about. Everyone deserves to be loved and whole. We need to treat people with respect. Sorry.
My name is Diana Sloan, and I was diagnosed with stage 4 rectal cancer at the age of 38. After an initial negative biopsy, my rectal tumor was removed. The next step in treatment, a doctor decided to do radiation. And I asked what we were actually radiating since the tumor was gone. And I was told it would be the tumor bed. I was not given any option to preserve my fertility because I already had children. so it was just assumed that I was done. I was told that I would be completely menopausal after my treatment, but what I was not told was the precautions that I needed to take to help with my sexual function in the future. I should have been advised about dilators that would be used during the treatment in order to preserve that portion of my life. For over 6.5 years, I've had intimacy issues. I miss that portion of my life. I wish I could have it back. If you saw the video earlier, that was my hot husband, the caregiver. And even though he doesn't ever say anything to me about it, and he says it doesn't matter, it does, and I know he does. I'm not the only one that misses it. He does too.
I am Wes Hensel. I was diagnosed with stage 3B rectal cancer at age 34. I was given 28 cycles of chemoradiation and 4 rounds of Folfox prior to an aggressive APR surgery with a pelvic lymph node dissection, which left me with a permanent colostomy. After surgery, I had 4 more rounds of Folfox before being declared NED as of about a year after my diagnosis. My diagnosis took 4 long years to receive, though, despite displaying consistent rectal bleeding during that time frame. Without even so much as a digital exam, I was told repeatedly that I had hemorrhoids and that I was too young for it to be anything else. I also found out unexpectedly during treatment that I have the MLH1 gene mutation, Lynch syndrome, despite having no family history at all of any cancers. Had I been diagnosed earlier, perhaps I would have avoided a colostomy and other treatment impacts that I'll have to live with for the rest of my life.
Please join me in thanking all of our survivors.